Welcome to AI Trailblazers, Voices of Healthcare Innovators. I'm Pranav Mehta,
And I'm Emily Joe.
and we're the co-founders of the brand new YouTube series. As artificial intelligence transforms healthcare, we're engaging with today's healthcare leaders to uncover their groundbreaking work. Learn from their visionary insights and inspire the next generation to drive transformative efforts through the ongoing technological revolution in healthcare. Today, we're honored to be joined by Dr. Jordan Perchik.
Dr. Jordan Perchik is a leading figure at the intersection of artificial intelligence and radiology. He serves as an assistant professor of abdominal imaging and informatics in the Department of Diagnostic Radiology at the University of Alabama at Birmingham, or UAB. Dr. Perchik completed his medical education at the University of Tennessee Health Science Center and his diagnostic radiology residency at UAB, where he served as chief resident. As president and co-founder of Artificial Intelligence in Radiology Education, or AIRE, he created and now oversees the largest free AI education resource for radiologists worldwide, which includes the pioneering AI literacy course that has reached over 500 radiology trainees across 20 countries. Beyond his groundbreaking work in AI, Dr. Perchik is a recognized leader in diversity, equity, and inclusion. He was honored with the UAB President's Diversity Champion Award in 2021 for his significant contributions to patient advocacy and inclusivity. His research and initiatives are shaping the future of radiology, positioning him as a key figure in the ongoing evolution of healthcare through AI. Today, we're honored to have Dr. Perchik share his insights on the transformative role of AI in medicine, particularly within radiology, as we explore the future of this dynamic field.
Thank you so much, Dr. Perchik, for your time. And to kick off this discussion, could you share with our members what initially drew you to the intersection of AI and medicine, particularly with radiology?
Yeah, well, it's a pleasure to meet you. It's a pleasure to be here today, and thank you so much for spearheading this very important effort. So my journey into radiology and AI is somewhat of an interesting one. I am very early in my career. I just finished my first year as an attending in the past couple of months, but I have really a lifetime of experience in radiology because my father is a radiologist, and I grew up watching him go to work. I watched the changes that happened in the field from the early 90s up through the current day. And it was very interesting. I have some of my first memories going into the dark room where the radiology films were developed. And I remember the smell of the films. I remember the red light that you would have to have in the reading room so that you wouldn't corrupt the images and you wouldn't that you would have to have while you're processing the films. And uh, I have just a very distinct memory of being what I thought was locked in the dark room when I was 4 years old. It was the most scared I've ever been in my life. I've since been told that I was not locked; the door was just closed. But tried telling that to a 4-year-old. But all that to say, in that lifetime, I've seen the radiology department go from something that was a part of the hospital that housed all of the radiology services to a digitized radiology department. So instead of having radiology films and everyone having to go to the radiology department, everything is now able to be uploaded into the computer. You can view these images from anywhere. And that was really what kickstarted a lot of the integration of AI into radiology, that these images became much more accessible, not only to other providers in the hospital, but to to industry partners who were able to use digitized images to train AI programs to assist in diagnoses and to even go beyond what the radiologist is able to see in the image. So, with all these changes, there have been a few what I like to call chicken little moments that the radiologists look at the outlook and they say, "Oh no, the sky is falling. Like the days of the radiologist is numbered." And one of the first ones that I can remember for that was in the early 2000s. One of the first AI tools for mammograms that was a tool that would go through that could detect areas that would be suspicious for breast cancer. And it would be able to help the radiologist find these areas And the idea would be that it could help them detect these cancers earlier. It could help them interpret these studies more quickly. It could help them interpret these studies more accurately. And there was a good portion of the radiology community that saw this development and say, "Oh, well, the days of the breast imaging radiologist are numbered. You know, it's maybe it's 5 years, maybe it's 10 years, maybe it's 2 years. But with this machine that's able to do this function, where does that put us?" And jump forward 25 years, breast imaging is a thriving specialty, and it's one of the most in-demand specialties in radiology. So that, along with several other developments that have happened in between that time frame. So we had this computer-aided detection in mammography. We had the uh, some of the pneumonia detecting tools that came up in the mid 2010s, and additional breakthroughs with the integration of some of the deep learning techniques and some of the more advanced AI machine learning techniques that were brought into practice in the 2010s and early 2020s. There have been really just such a rapid development of some of these tools, which has made a lot of people in radiology and people who are considering going into radiology uh, very nervous about the future of the field. But at essentially every step of the way, uh, there's a redemonstration of the hype cycle. That there's this breakthrough, there's the expectations of what could happen, there's the integration of the tool, and then we have to come to terms with the reality of what these tools look like in practice, which often is very different from what we were expecting. So, seeing that over the course of a lifetime in the field has given me kind of a different perspective on what the future of AI in radiology looks like.
Yeah, kind of like along those lines, like what are like the most significant, I guess, examples of where AI has been revolutionizing patient outcomes in radiology, especially in the recent years with like, I don't know, ChatGPT and all these other tools coming out?
Yeah, so it's kind of an interesting question, the revolutionizing patient outcomes. There's a lot of innovations that AI has come in and has revolutionized our workflow, that it has made some of the different processes in the radiology exam life cycle more efficient. So being able to acquire images with less, using less power or using less radiation, having to use less contrast, uh, and allowing us to, do different things with imaging that we hadn't been able to do before. And there have been a lot of innovations that have made promises that they could really revolutionize patient care. One of the areas that I think is most significant and most widely distributed throughout the country are some of these applications for intracranial hemorrhage and for pulmonary embolus. So patients that come into the hospital that might have a bleed inside their head, so a brain bleed that needs emergent treatment so that they don't get worse, so that they don't, have terrible complications, potentially pass away. The adage is time is brain for, or when you're dealing with stroke, time is muscle when you're dealing with a heart attack. Uh, and so, these very high acuity situations, we want to make these diagnoses as soon as possible. So there are applications that are going through and processing images in the background. So before we even see them on our computer, this AI tool can highlight this image or highlight this study as high suspicion for an intracranial hemorrhage. So it moves this up to the top of our work list. It allows us to see that this is an emergent study that needs emergent interpretation. And the idea with that is that instead of sitting on the list for another 10 minutes, 30 minutes, hour, 2 hours, maybe longer, depending on how busy your work or how busy your practice is, this could be interpreted in 1 or 2 minutes, and then this patient could be treated more quickly.
Yeah.
Uh, that said, we've personally done several studies on this type of application for intracranial hemorrhage, and also one for pulmonary embolus, so blood clots in the lungs. And there are many, many other applications that are a similar type of application. We call this computer-aided detection and triage. So it's not just detecting the abnormality; it's also triaging the study on the work list. But when we've studied these types of applications, we have found that at least in our practice, they don't make nearly as much of a difference in actual time to treatment as is promised by the AI companies. So at least in our practice, we have a very efficient workflow. We get through these studies really very quickly. We have a high accuracy rate. So at least in our own setting, the difference of maybe a couple of minutes in time to our diagnosis really wasn't translating into really a time to treatment or like a patient outcomes, or like really not translating into like significant patient outcomes, we could say. So we're still kind of in this potential space that we imagine how these things could make their clinical impact. But when we've evaluated these things objectively, it still comes out to a big to be determined.
Yeah, that's a great point. There's when talking about conceptualization to integration and application, there's this ongoing narrative of making sure AI aligns with health equity. And so that's one thing we wanted to ask about. How do you balance the ethical considerations of AI in medicine with how rapidly it's growing right now?
Yeah, so it is. We're really at a very interesting point that AI is becoming more widely integrated, but it's really mostly limited to very high power, very high resource institutions. So the areas that are able to pay for a tool that may cost, $50,000, $100,000, $200,000 or more to provide a service that more often than not will not be reimbursed. So this is a service that will. The aim is to improve patient care and to improve the accuracy and efficiency of the radiologist. But in terms of something that can be billed for and that's reimbursable to the practice, the dollars and cents for individual radiology practices has kind of lagged behind in a lot of ways to the technology. So figuring out how to pay for these things really takes precedence in a lot of situations over, this is something that could improve our patient care and could improve patient outcomes, but you know, you're taking a bit of a risk, right? So it's not a proven benefit in a lot of time or a lot of times to improving patient outcomes, and it's also a pretty substantial expense uh, for something that will likely not generate a return on investment. So that kind of, the danger with that is that if you do have something that is leading to a real breakthrough in clinical care and patient outcomes, then you create this two-tiered system, right? That now going to a high-powered institution or just living in a larger city that has access to a larger hospital, you get a very different kind of care from the radiology department than you would at a more rural, lower resource hospital setting.
Oh, yeah, definitely. And in addition to like the ROI of AI integration, there's also the data that a lot of clinicians are using can be stemmed from biases over time, right? So there's also the importance of like the public health intersection. Um, and so yeah, we completely agree.
Yeah, certainly. The pitfall of algorithmic bias is one of the
Mm.
areas that I think really keeps a lot of us up at night. That the development of these hidden biases that are so difficult to evaluate for, and that it's so difficult to really assure this quality over time. That you really have to do such careful monitoring and you have to do such in-depth monitoring to make sure that these AI applications are behaving equitably across different patient populations. Um, and just as an example of that concept, so a lot of these AI applications are trained, at high power research centers that, these are going to be often in the United States. A lot of them are coming from Europe. So the UK, Netherlands, Germany are very prolific with their AI research. A lot of research coming from China. Uh, but when you think about the patient populations that have imaging data that these companies are using for training, there are a pretty substantial set of patient populations that are not well represented in these areas, and may be excluded from the original training. And when you think about radiology images, a lot of us might think, well, a chest X-ray is a chest X-ray, and it's like, why does it matter if I am born in Birmingham or Austin, Texas, or if I'm from Europe or Asia, Australia, Africa, South America. Uh, but it's very, very strange how these very complex AI applications can make their associations. And there was a publication a couple of years ago, I believe it was maybe 2022, from a group out of Emory, that they were able to determine that an AI application could determine a patient's race based on a chest X-ray, and it was a very it was a very strange conclusion that it was able to do this really very accurately. And if you were to do this to any human radiologist, if you were to give them the same task, I would have essentially no idea if an X-ray was coming from a black patient, a white patient, Hispanic patient, Asian patient, and the conclusion itself that the AI was able to do this wasn't itself alarming, but the fact that it is making these connections and potentially introducing not only biases from the data itself, but introducing new biases and new connections was really concerning.
Yeah, that's a really interesting finding. I wouldn't expect that. But kind of like
Yeah,
along,
I'll be happy to send you the article. It's a very good article.
yeah, sounds good. We'll be happy to like link it in the um bottom of the video. But like kind of along those lines and like along what you said about like how cost and location kind of determines how much access you have to these like AI tools, what challenges have you observed that physicians face during this like AI revolution? And how do you address these in your work?
Yeah, so we're in a very interesting point that for several of these breakthroughs, and again, I'll point to radiology again for this, but we've had several breakthroughs in radiology that we have a new technology or new modality that comes out, uh, and then once we realize or once we decide that we're going to integrate this into our community, you have a stage where people are having to be trained. It's very intentionally integrated into our resident education. You have courses that are coming out through the national radiology societies. So if you go back even a few decades, radiology, we didn't have CT, so computed tomography, where we go in, you get cross sectional images of the body. Uh, we didn't have MRI, so the magnetic resonance imaging, that's a completely different modality. So not using radiation at all, but using very high strength magnets. Ultrasound has changed completely. And so for each of these different modalities, you had to be very intentionally trained on what these different types of images would look like. And the machines are very expensive. They require their own rooms. They require different types of quality assurance and upkeep. Uh, and so I think about that, and then I think about how artificial intelligence has come into radiology, and artificial intelligence has really just been a pop and it's there. So we haven't been nearly as intentional about the amount of AI education and training that people have to use these in practice. And to a point, that's to a point you can understand, because this isn't a completely new modality that you're seeing completely new different types of images and studies coming through. It's a lot of times just a pop up of, oh, there's a brain bleed on this patient, or oh, there's a pulmonary nodule on this patient, or there's a breast cancer on this mammogram. Uh, so it's been been a little bit more of an insidious integration into radiology that has been uh, it's been kind of slow. It's been very targeted, and because of that, we haven't been nearly as intentional about including AI in our training. Uh, but that is really it's really quite dangerous that we are getting to the point that we have much more advanced applications, we have a much higher number of applications, and when we have a larger number of practices using I think a recent survey showed it was over a third of practices in the United States are using AI in their practices. But I would wager that probably less than 10% of the radiologists that are using AI have actually been trained in AI. So physicians that haven't been trained in AI, just like anyone else in the community who hasn't been trained in AI, are subject to biases and more prone to accepting those biases. So one of the other pitfalls of clinical AI is automation bias. So when the AI tells you that there is an intracranial hemorrhage, or there is a breast cancer, or there is a clot in the lung, you are often going to be more prone to accepting that outcome because it came from the AI, and you trust the AI even more than your own clinical judgment. So if I look at the exam and I know that I see the brain well, and I see what I consider just an imaging artifact uh, inside the brain, but the AI is telling me it's a bleed. I have to take that extra second to convince myself now. It's like, well, is it a bleed? It's like, is this going to be something that I'm willing to defend and send this patient home and tell them that they are normal, or is this something that I'm going to trust the AI, even though I'm confident in my own interpretation that the AI is incorrect? And there is risk in that as well. So a lot of these are very high stakes exams. So someone having a blood clot in their lungs or having a bleed in their head, it sends them down a very different treatment pattern than if we were to call this a normal exam. So extra days in the hospital, potentially going on to anticoagulation, maybe getting a evaluation from neurosurgery. So not only just the added financial cost to the hospital system and the patient of this extra workup that's unindicated. But if you go into an inappropriate treatment realm, then you have the potential for uh, not causing just financial or a financial burden, but also causing genuine harm to the patient.
Yeah, with this like increased pervasiveness and increased reliance on AI you mentioned, like there's a general sense of concern about AI potentially taking over jobs in healthcare, especially in radiology. What are your thoughts on this, and what advice do you have for students and residents regarding this trend?
Yeah, so I would say that this stage that we're in with radiology AI uh, has been another Chicken Little moment in the field of radiology. That back in 2016, I think that was really the breakthrough year that some of the more advanced AI applications were coming through, and there were some very call them maybe overly optimistic projections of what AI was going to be able to do once it got into wider practice. And I believe that there was a quote from someone in venture capital or in the tech industry who said, "Oh, by 2020 or 2022, there won't be a single human radiologist in the field." And as far as I know, it's 2024, and we are still thriving, doing quite well. And in fact, probably nearly every practice in the country is hiring, just because the volumes are going up. This is a very valuable service that we provide to patient care, and the more experience that we get with AI. So these breakthroughs in 2016, 2017 started to get integrated into clinical care in the following years. So since about 2018, we've had a pretty exponential rise in the number of FDA cleared AI applications that are in practice, and I think we're now probably over. I think we're over 300 or 400 the last time I checked in radiology. Uh, but the more that these are integrated, the more that we realize that the AI applications that we currently have are very narrow. They do a single task on a single modality, and they are doing these tasks when they're involved in image interpretation to augment the radiologist. So all of these applications are radiologist assistant tools. So they require they require human oversight. They require the radiologist to have the final say, but they also require that the human radiologist is going to be the expert. So they know not only how to interpret the image themselves, but they know when to override the AI to say when the AI is incorrect. So at this, with the current status of radiology AI, uh, all of these applications that are involved in image interpretation require human oversight. So with this status, we are very, very safe as a specialty. Uh, as applications become more luminous and are able to do more things, like once we reach a stage of general AI, that we don't have these very narrow AI applications that do only a single task, but can do multiple tasks on multiple modalities. Uh, I'm still very confident that even at that stage, the human radiologist won't be going anywhere, and that's partially to be able to provide the expertise to put those findings into context, to be able to work with other clinicians, to be able to provide the patient care aspect of radiology and participate in the multidisciplinary conferences that we do. So there really is a very human side to radiology that often people outside of radiology forget about, and that part is not going anywhere. But there is a very well known and very well circulated quote from a radiologist who, around that time that there was the big AI scare in the mid 2010s, uh, he liked to say that AI won't replace radiologists, but radiologists who use AI will replace the radiologists who don't.
Mhm. It's a good point, especially because AI is seeming to show like precision, right? But there's still that requirement for a strong checks and balance in the humanistic component you mentioned. And so that's good. Thank you for clearing that up for a lot of our audience. Dr. Perchik, so right now you're at the forefront of innovation. You co-founded this groundbreaking AI and radiology education course, education, AIRE. What inspired you to start this initiative, and how have you seen it impact the field since its inception?
AIRE is one of our proudest accomplishments at UAB, and with this whole cohort of researchers that we've been able to recruit into our initiative. Uh, it really started from a very personal and very local place, that seeing all of the changes coming with AI and all of the fear and anxiety with AI when I started my residency back in 2018. When we are talking about that, 2016 was really this turning point. That was exactly when I was starting to get into radiology. So I was putting together my application, doing these interviews, and that was back in the days of in-person interviews. So every different place that you go, different applicants that you meet, different residents that you meet, uh, everybody's having the same kind of conversations of like, oh man, is this field still going to be here by the time that I come out? And I really wanted to learn more about this when I was going through. So it was a big part of how I picked my program, that I decided to go to University of Alabama at Birmingham, because they had a strong AI research lab, and a few very prominent people in the field were at UAB at that time. But once I enrolled and I was taking a look at our education curriculum over the course of the year, I realized that we had some AI research. We had some tools that were already in place and integrated into the workflow, but we didn't really have anything on the education side. So I knocked on my program director's door, and I asked her if we can start an AI education program, and she said, "Okay." She said, "Put something together, and we'll give you a week." And so I started working on a curriculum for a 1 week AI course with a couple of the AI researchers and a few of the attendings that I worked with, who I knew were very passionate about AI and radiology. And so we put together a course. We did this in 2020, and it was a great success, very well received by the residents. And as you do in academic medicine, we took polls, we did evaluations, we published our research, and we presented at a few different conferences across the country. And the more that we talked about it, the more that we realized that this wasn't just a UAB problem. Uh, this wasn't an Alabama problem. This wasn't a Southeast U.S. problem. This was a national and international problem. That AI education and the opportunities for AI education are extremely limited, despite there being a very high interest among residents, and very obviously will be a need for this type of programming for radiologists to be successful in the future. So this was our turning point, that we decided to make this open and available to programs across the country. So from our original course in 2020, we founded AIRE, the Artificial Intelligence and Radiology Education. In the following year, we led a regional course with 9 programs in the Southeast United States. The next year, it was a national course. The next year, it was an international course. And so each year we grew, partially by word of mouth, partially by outreach to different programs and program directors. And our jump into the international space was with partnerships with some of the international radiology organizations like RADAID and Health for the World. And these are non-governmental organizations that work with public health and global health, but they also have an education wing. So we partnered with them and their informatics programs to provide these lectures for free to radiologists, radiology trainees, and different staff all over the world, free of charge. And we've done a lot of learning along the way. That our initial strategy of doing these lectures remotely on Zoom was a great solution for us when we were just in the Southeast. But even when we get to the national stage, issues with time zones made it a little bit more difficult to attend in different parts of the country. And then especially when you get to the international stage, it is very challenging to pick a time that is going to be workable for everybody everywhere in the world at the same time. So we still do our remote course. We hold it on Zoom every year, but we will record our lectures and we post those for free to our YouTube channel. And through our partnerships with RADAID and Health for the World, we also provide those lectures to them, so that in countries that don't have access to YouTube, those are in an available format that they can be viewed, uh, uh, regardless of setting.
That is truly revolutionizing, Dr. Perchik. From your experience integrating this across, from what we've seen, 500 plus radiology trainees and 20 countries counting. That's what we last saw. What do you find are the biggest takeaways that you want academic systems like hospitals, physicians, what do you want them to take away from to increase AI in education for their respective subspecialties, right? You're changing the pace for AI in radiology, but there's so much more. So what are the biggest takeaways you want them to gain from this?
Yeah, certainly. So I think that one of the greatest takeaways from our experience with AIRE is that this is not an initiative that can really realistically be done alone. So identifying partners and trying to take steps to democratize access to AI education is going to be critical for the medical community in the near future. So if we treat this like we have other different breakthroughs in medical care, and we just like wait for it to diffuse out, and for each individual medical system, medical school program to find ways to integrate it into their education, uh, that strategy is not going to work for AI, and it's not going to provide the kind of training and the kind of knowledge that's going to be needed for such a rapidly evolving technology. So we need to leverage the expertise that we have at different institutions, that we can serve as a hub and spoke model, that we can have lecturers from high-powered institutions that are high-power, high-resource institutions that can provide their expertise in some areas, with other leaders in other areas, coming together to offer accessible, practical AI education for the medical community at home and abroad. Uh, and that's something that we've found repeated time and time again with our program, that when we go into different communities and we add new partners, and even partners coming from very high resource institutions. Not everyone has an expert in every single field of AI that's necessary to be a well-rounded physician and a competent user for AI. So many places might have someone who's very well versed in breast imaging AI, so those mammogram techniques, the breast MRI, but they might not have someone who knows neuro AI or neuroradiology AI. And then similarly, you might have someone who's very good with radiographs, not very good with CT. It's very challenging to find people who are well versed in artificial intelligence for nuclear imaging. We're getting really into the weeds here, so I'm going to back up to the 10,000-foot view uh, and say that even at high power institutions, not everywhere has an expert in every facet of AI. So being able to leverage our resources as a community, we can put together a much more comprehensive and a much more well-rounded curriculum. And that emphasis on community is something that we can is inherent to AI education as it stands currently, and is something that needs to be more or made available to physicians, be made available to students and learners throughout the world.
Yeah, that's a great point. And one last question that we had is that, for the next generation of leaders, what is one piece of advice you would give to students who aspire to lead and innovate at the intersection of AI and medicine?
My advice to students who are getting into AI would be, uh, you don't have to be an expert in everything. Uh, I think it can be very daunting when you're starting out to try to figure out, well, do I need to be an expert in coding before I get into AI? It's like, what kind of do I need to have a master's in informatics before I get into AI? Do I need to have tens of thousands of hours in Python before I get into this? Find an area that you're interested and start. Uh, the fundamental terms and methods that you really need to have a basic understanding of AI can truly honestly be learned in an afternoon, and then from that foundation you can go out and you can find the areas that strike your passion, and once you find that area, that's when you can go and do the deep dive. But AI is such a broad field that has applications in so many different elements of patient care. uh, so I think starting broadly and then finding the areas that you're passionate about uh, to take your deep dive is a good approach.
Fantastic. Dr. Perchik, you are shaping the future of artificial intelligence in healthcare, and your work is absolutely groundbreaking. Um, on behalf of AI in medicine and the entire series, we thank you so much for taking the time to share your valuable insights and experiences with the next generation of healthcare leaders today. We look forward to seeing the continued impact your efforts make in both AI and radiology.
That's all for this episode of AI Trailblazers, Voices of Healthcare Innovators.